someone wholly inadvertently. Social distancing works, and you need social distancing everywhere. There's a significant amount of noncompliance, especially in New York City, especially in the parks. I'm going to go down there today. I want to see what the situation is myself. But it has to be stopped because you are endangering people. And if it's because of misinformation, if it's because of noncompliance, I don't care, frankly. This is a public health issue, and you cannot endanger other people's health. You shouldn't be endangering your own, but you certainly have no right to endanger someone else's. This is my personal opinion. This is not a fact. To me, it's very important that, especially in a situation like this, tell me the facts and then tell me your opinion. This is my opinion. We talk about social responsibility, especially young people talk about social responsibility, and they should. We pass a lot of legislation in this building, groundbreaking legislation, national firsts on economic rights, first highest minimum wage in the United States of America, human rights, first state to pass marriage equality, which I believe was a human rights issue. We talk about environmental responsibility. This state has the most aggressive environmental laws in the United States of America, and I am proud of it. But I also want people to think about the social responsibility when it comes to public health. We haven't talked about it before. It's not really a field. It's not really an issue. It's not really a hashtag. But social responsibility applies to public health just as it applies to human rights and economic rights and environmental rights. Public health, especially in a moment like this, is probably most critical. So let's think about that, and let's act on that. In this crisis, think of ourselves, we are all first responders. We are all first responders. Your actions can either save or endanger a life. So we are all first responders. What's going to happen? We're going to get through this. We don't know how long it is going to take us to get through this. Fact is, we're trying to slow the spread of the virus to a number of months so the healthcare system can deal with it. So therefore, by definition, it's going to be a number of months. I know people want to hear it's only going to be a matter of weeks and then everything's going to be fine. I don't believe it's going to be a matter of weeks. I believe it is going to be a matter of months. But we are going to get through it. And how long and how well it takes us to get through it is up to us. It depends on what we do. You know, when you're sick and you say to the doctor, well, how long until I get better? And the doctor says, well, it depends on what you do. If you follow the advice, you'll get healthy faster. But it depends on what you do. This depends on what we do. China is now reporting no new cases. Let's assume that's true. Look at that trajectory and look at that turnaround. Look at what they did, right? We do have data that we can follow. So how long is it going to take? It depends on how smart we are and how responsible we are and how diligent we are. You tell me the percentage of compliance and intelligence and discipline on social distancing, etc. I'll tell you how long it takes us to get through it. Also, something that people aren't really talking about, but I think we should start talking about. We talk about the economic consequences of this situation, and they are going to be significant, and we are going to have to deal with it, and New York will be right on top of it and as aggressive as we are with everything else. But economic consequences come second, right? First is dealing with this crisis. And we talk about the economic consequences, but we also need to talk about the social consequences. And it's hard to gauge and it's hard to measure because there is no Dow Jones index that we can watch on the screen that is measuring the social consequences and the social decline. But the stress, the anxiety, the emotions that are provoked by this crisis are truly significant. And people are struggling with the emotions as much as they are struggling with the economics. And this state wants to start to address that. I'm asking psychiatrists, psychologists, therapists who are willing to volunteer their time to contact the state. And if this works out, I would like to set up a voluntary network where people can go for mental health assistance, where they can contact a professional to talk through how they're feeling about this. They're nervous, they're anxious, they're isolated, can bring all sorts of emotions and feelings to the surface. When you're isolated, you don't have people to talk to. So I'm asking the professional mental health establishment to contact us, let us know if you're willing to volunteer time. It would obviously be all electronic. It wouldn't be in person. It would be over the telephone. It would be Skype, etc. But I'd ask you to seriously consider this. Many people are doing extraordinary things during this public health crisis. I'd ask the mental health community, many of them are looking for a way to participate. This is a way to participate. And if we get enough mental health professionals willing to volunteer their time, then we'll set up a mental health electronic help center. And we'll talk more about that in the next few days. What happens, besides how long, what happens? The bigger question to me is, what do we learn about ourselves through this? As a society, we have never gone through this. Thank God, we haven't gone through a world war. We haven't gone through any great social crisis here in New York. We went through 9/11, which I think is relevant in terms of some feelings that are now people are experiencing. 9/11 transformed society. I was there. I was part of it. You were never the same after 9/11. You had a sense of vulnerability that you never had before, which I feel to this day. There was a trauma to 9/11, but as a society, as a country, we've been blessed in that we haven't gone through something as disruptive as this. So what do we learn about ourselves? And I think what we're seeing already is a crisis really brings out the truth about ourselves, first of all, and about others. And you see people's strength and you see people's weaknesses. You see society's strengths and you see society's weaknesses. You see both the beauty and the vulnerability. You see the best in people and you see the worst in people. You see people rise to the occasion, and you see people fall from the burden of the emotion. So I think you take a step back. First, there are people who are doing extraordinary work, who deserve our thanks. And when you see a healthcare worker on the way to work, when you see a grocer who's been working a double shift, trying to deal with the demand in these stores, when you see a pharmacist who's overwhelmed with the long lines, when you see a police officer, firefighter, who they're out there doing their job, they're opening doors, they don't know who's on the other side of the door, they're walking up to car windows. These are just ordinary heroes. Heroes. Ask yourself, would you do that? I mean, what kind of selflessness and courage? You talk about public service. What does public service mean? This is public service. This is public service in stereo and on steroids. These are people really stepping up. When you see them, say thank you. The bus drivers, the subway drivers, the public transit workers. These are people who are showing up. They're leaving their family. They are just as nervous as you are, but they're doing their job. Child care workers who are watching people's children so they can go work in a hospital or do their essential function. They deserve our thanks. And I think understanding what they do in some ways gives us a perspective on how beautiful people can be and how courageous people can be and how great Americans can be. And my last point is practice humanity. We don't talk about practicing humanity, but now, if ever there's a time to practice humanity, the time is now. The time is now to show some kindness, show some compassion to people, show some gentility, even as a New Yorker. Yeah, we can be tough. Yes, this is a dense environment. It can be a difficult environment. It can also be the most supportive, courageous community that you have ever seen. And this is a time for a little gentility. It's a time for a smile when you're walking past someone. It's a time for a nod. It's a time to say hello. It's a time for patience. And don't let the little things get you annoyed. That's New York at its best. That was New York after 9/11. Yeah, we have a problem. Yes, we will deal with it. Yes, we will overcome it. But let's find our better selves in doing it. And let New York lead the way in finding their better selves and demonstrating their better selves. That's the New York destiny, and that's the New York legacy. And that's why I'm proud to be a New Yorker. That's why I'm proud to be the governor of this great state. And we're going to do it like we've always done it before. Questions?
Governor, on the 6,000 ventilators, where were those located and how soon could they be in hospitals in New York?
They were located in places all across the globe, Jesse. They will be coming in over the next several weeks. We're also looking, by the way, at technologies that would allow you to use one ventilator for multiple patients, where one ventilator, for example, could serve 2 patients. So we're getting as creative and as aggressive as we can.
And can we assume that most of those would end up in New York City, considering that's where the bulk of the cases
are? They go
are?
where the cases go, yes.
Governor Cuomo, I just got off the phone with a very emotional doctor locally here in the 518 who tells me that they are out of hospital gowns, that they have no masks, that they are reusing hospital gowns that potentially could have been exposed to a patient with COVID-19 and without COVID-19. Response to that, message to them.
Look, this is a national problem, the medical supplies. States are scrambling all across the board. I'm proud of everything this state has done and the extraordinary efforts. As I told you, we have people on the ground in China. I'm calling people all across the world for these supplies. We have apparel companies that will go into the gown manufacturing business. We have to secure the material, which we're trying to do now. We're working on getting the New York State. New York State also manufactures uniforms. If I can get the material, we'll make them in the state. I have companies in New York where we're buying equipment, sewing equipment, and manufacture them. But we have a gown shortage statewide.
I just have a couple of questions.
It's not just Albany. It's worse than that. It's a gown shortage statewide. We're doing better with masks We're doing better with ventilators, nowhere near where we need to be with ventilators. We need 30,000 ventilators, so we're at 6,000. But at least we got the 6,000. The masks, the medical community has told me over and over again, the masks are the priority for the COVID-19. So we have made progress on masks. Gowns are also very important, no doubt. But we have not been successful as of yet with finding a supply of gowns, but we are searching high and low.
With the number of masks, I think you said 2 million, right? The N95 masks, 1 million are going to the city. I forget the other numbers that you were saying, but what amount is staying here in upstate New York?
We have enough masks to handle all of upstate's need. The numbers are very different between Albany and New York City, right? So we do the allocation based on where the cases are. And New York City, Westchester, Nassau, Suffolk, that's the locus of the problem. Masks for upstate hospitals, we can address that. We can fill that need as of now.
Questions on testing. First of all, people are wondering, have you been tested?
Nope.
And why not?
Because I've not been exposed to anyone who is positive. I don't have a fever. I don't have any symptoms. And I don't want to waste the test.
The two major hospitals in Albany are saying they're not going to be able to test the members of the public, even though they have symptoms. They have to save it for the healthcare workers. Is that a concern?
The hospital, we are testing by the same protocol all across the state, Karen. If you meet that protocol, then you get a test. And it's on the website. If you have been exposed to someone positive, if you are showing symptoms, if you meet that protocol, you get a test. And again, we are testing more than any state in the United States of America. We are testing more per capita than China and Korea. So yes, no state, no country can give everybody a test who wants a test. But that shouldn't be the goal either. This is not just, I want a test to make myself feel better. And by the way, it won't even make you feel better because, okay, you didn't have a test at 10, you tested negative at 10 a.m. But then you went and you talked to 6 people, maybe you're positive again. You'll never solve that neurosis, right? That anxiety. But anybody who fits that protocol can get a test. And more people are getting tests in this state than anywhere else, and that is good news. And look, I'm very proud of what we did. We were all starting at the same place, and for us to come up to scale that quickly and get to scale where we're doing more than anyone else, that was great.
Governor, you mentioned that the 39-year-old healthcare worker from Iran is now doing well. Do you guys have a figure as to how many people have recovered and what the current death is?
We can get you those numbers. I don't have them with me.
About the technical issue with the federal legislation, what do you mean by that? And is that in the House bill or the one that's being negotiated in the Senate?
The House bill that passed, a little weedy, but the House bill that's passed said for a state to get the federal money, it can't make any changes in the Medicaid procedures. In this state, since January, I announced the MRT, the Medicaid Redesign Team. They issued their report that changes procedures in the Medicaid program. I've been doing that since January. We can't do a budget without changes to Medicaid. And by the way, you need changes to Medicaid because there's a lot of waste and inefficiency in Medicaid on those long-term programs, as we've been discussing for 6 months. They then wrote a bill that said, it's not really funny, it's like sad, but it's like either you cry or you laugh. They wrote a bill that said if you change any procedures on Medicaid, you don't qualify for the federal funding. I know, but we've been changing procedures since January.
Governor, the 4 field hospitals you're talking about, are those essentially outdoor MASH units? What would those look like?
The 4 field hospitals, you have 2 types of, I call them pop-up hospitals, and they say, don't say pop-up hospital, which only makes me say pop-up hospital more. The field hospitals are done by the FEMA. They are equipped hospitals that do 250 people each. They're basically a tent configuration with beds, with medical equipment, with staff. And they come in 250 bed capacities. We requested 4 of those, so 1,000. The Army Corps of Engineers, they basically do a tent-like facility. They can do it in a gymnasium. They can do it in the Westchester Convention Center. They can do it outside, but then it needs an HVAC system, climate control system. That is more of just a tent structure itself without the beds, without the medical equipment, and without the staff.
So the field hospitals would be set up where? Would they be adjacent to hospitals, or would they be in parks?
We're talking about the field hospitals, 1,000 beds in Javits. Again, if it works, if it fits, this is all preliminary. I have to talk to the Javits people about the electric service, et cetera. But 1,000 beds in Javits, and we don't have a number yet in those other 4 locations.
Governor,
Excuse me 1 second. Where's Gareth? Gareth, is that all correct?
Yes.
Okay.
Governor, have you had any consideration of pulling maybe vulnerable people out of state prisons that may, if they get infected, it might spread like wildfire in there?
If we're watching that situation very closely, when we don't have a significant issue yet of spread in the prison system, we've taken certain precautions. We've stopped certain visitation. But if we have a problem, we'll address it, but we don't have that problem yet.
So you're not pulling people out yet. You're waiting to see what happens.
Right. If we have a problem, then we'll address it.
On those N95 masks, does the 2 million come from the state's own stock at this point, or is it?
No, those are 2 million that we are acquiring. How many, Simonita, how many new N95s have we identified to buy?
That's most of the stock, and we've been at this for weeks. And then yesterday, of course, we've had so many people reach out, and so we're sorting through that to get more. We're looking to buy in bulk, obviously, and get as much as we can.
2 million are the number of masks we can have identified to buy. Now, by the way, even when, just a little caution, these are companies who say, I have the masks, I will sell you the masks, I will send them by this date for this amount of money. And just so you know what's going on, masks that normally cost 80 cents are now $4, okay? These are 95 masks. But, look, it's price gouging, but we need them, and most of these are coming from overseas. But so far, 2 million new masks we've identified.
The 1 million that are going to New York City, how is the state determining which hospitals or health facilities get those?
There's a trade association called the Greater New York Hospital Association. That's what Ken Rasky runs. So between the voluntary hospitals and the public hospitals, they'll be distributed proportionately.
Governor, regarding the consequences to the state treasury, I agree that public health is job one, of course. I drove in here thinking about something Governor Mario Cuomo once said about advocates asking him to do this or that, fund this or that, and he said, you know, which SUNY campus do you want me to close? Yet Governor Carey once said that the days of wine and roses are over. So when these advocates are coming up in this climate, it seems to me that some of the press releases that I see, et cetera, are rather Pollyanna-esque, because that they haven't really fully adapted to this new reality. So is it a time for a reboot as to expectations as what the state can do for towns, cities, for all these groups that are out there relying on the state for funding? And do we need a pay freeze, for instance, which you probably can't do with the union contracts, but going forward, are we going to see some very heavy-duty measures?
Yeah, Joe, thank you for remembering my father. My father governed at a time a little more candid and blunt, and he was. He also didn't have a lot of tolerance for frivolity or or nonsense. Look, the advocacy community, their job is to ask for more money, right? Every budget, more money. Well, I'm giving you 100% more. It's not enough. I'm giving you 200% more. It's not enough. What number would be enough? No number, because I get paid to say I want more, right? And an advocacy organization, by definition, can never say it's enough, because then they put themselves out of business. To be advocating, and we did a budget proposal that was very rich to begin with. To be advocating for more state funding in this situation is beyond the pale of a colorable claim, right? The state is obviously broke, to use a term. The revenues are devastating. We're spending money on health care at an alarming rate. So, yeah, it's silly, it's trivial, it's petty politics. It's not just my father. Look, I've never had patience for the petty politics. I never have. It's not why I'm here. It's not what I want to do. It's not what I respect. And I've never had the patience for the petty politics. Neither did he. I'm here to do big things, to make the big changes, real issues. So I don't even take those press releases seriously in the first place, to tell you the truth.
Can you talk about the executive order to suspend speedy trials?
I can't really. Can anyone?
We signed an executive order a couple of days ago because the court system is currently shut down, and if we didn't address that, then cases could be dismissed on technicalities, and so it was an action we had to take. We did the exact same thing after Hurricane Sandy. Obviously, it was something we did not want to do, but given that the court system is currently not functioning, we had no choice.
On the 90-day eviction and mortgage question,
Sure.
are those mandatory orders to lenders and to landlords?
Mandatory.
Because the language in the DFS suggests that they're being urged.
I can take this. So DFS did what's called a circular letter that provides guidance. They actually struck an agreement with the banks. We try to do this in a way where we're not dictating to them, but we did see some people who are detracting, and so we're formalizing by executive order today.
And so it will be mandatory
Correct.
that lenders and landlords will not be able to evict?
Correct.
Okay, thank you.
Circular letter. Government often uses circular reasoning also, Jesse.
What happens with the remaining few months of the session? Do we have...
Pass a budget, pass a budget, pass a budget, pass laws. Police officers, everyone says this is, I took a hard stance. Government must function, especially now. Especially now. I made the point to Joe about petty politics. Look, from my point of view, 85% of the stuff we do is all petty politics. 15% matters. Minimum wage mattered. Marriage equality mattered. Andy mattered. Building airports matters. Building bridges matters. What we do here matters. What we do in this moment of time matters. This is government. If it's done well, it saves lives.
I want to thank all Americans.
That is not a rhetorical statement. It's not overly dramatic. It's government professionals who know what they're doing can save lives. It totally changed the lens on government. Oh, I thought government was about celebrity and who can tweet the most and who had the most Twitter followers. No, no. Now government is about, do you actually know what you're doing? Does your government actually work? Can you mobilize it quickly? Now, government is serious. Oh, wow. I didn't even think of this. And by the way, for a whole generation, they've never seen this. They've never had to see government really step up and function, right? That's where we are now. What should government do for the rest of session? It should do its job. This is the high point of government necessity and competence and performance and accuracy. This is when you need government to work like you've never needed it to work in your lifetime with the highest consequences. And Police officers are showing up at work. Firefighters are showing up at work. Public transit workers are showing up at work. You're telling me the elected officials can't show up at work? Come on.
They can come here and do it safely.
Karen, they can follow the same rules that apply to everyone, but can an elected official, legislator, do their job? Of course. Can a police officer do their job? Can a prison guard do their job? Can a firefighter do their job? Can a nurse do their job? Can a bus driver do their job? Yes. Cavernous complex and do their job. And certainly an elected official can come. I'm going to work. Thank you, guys.
Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This one? You are not getting this? White House 2, Lobocam. I think the micro setting is different. We have another microphone for the Lobocam. Okay. I see. This one, 1, 2, 3, 4, 5. You got it? Okay. Okay, for the Robocom microphone. Okay. Okay, not the first one. Okay, this one. Okay, got it. And the RSB is this I we just checked it okay to use, right? Okay. Okay, sounds good. Okay, thank you. Bye.
you.
You're welcome. Here you go, man. You're welcome.
So efficient.
Right, it is.
That's pink.
That's obviously pink. Obviously, clearly.
Not clearly.
No, clearly. We didn't have a thermometer at home, and there's no thermometers anywhere. Everything is sold out. I mean, every store, every online store, everything, they're all gone. But apparently pet thermometers work, so we bought a pet thermometer.
Dogs are they're Celsius.
They are. They do have Celsius on there too.
Well, I have the digital, but we used to have.
You were on CNN for about a minute.
We had the
When you were checking your
mercury thermometer. You probably had those as a kid too, right?
Oh, really?
Yeah, you were on.
You're the kid.
Oh yeah.
No, you were going
For
out
sure.
with everybody.
For sure. Was the back of my head on there, Bill?
It was okay.
Your hair looked great. The back of your hair looked great too.
Nice.
And if you go get a mic checkup, everyone will give you a text or an email. I saw you on MS because MS leads. I mean, you guys are up now, probably. Yeah, probably. Yeah, but I had, I was telling Bill, I don't know if I told you, I had my physical Monday, and the doctor suggested getting a shingle shot. Sure. He says you'll be pain, you'll feel like you're like a little, tired maybe.
Were you able to get one?
Yeah, I got it. And they paid for it because they're taking
I went to get one.
And I knew exactly who my girlfriend was Googling this.
More and more cases of COVID-19. % of patients have symptoms that are significant enough to require hospitalization. It will tax the resources of medical centers, hospitals, and health systems. They have their own stores of personal protective equipment and other resources, but we have our own stores through the Department of Health and PEMA of personal protective equipment, ventilators, and other resources. And there are national stores. We also are looking at all options and very innovative options to try to get more, for instance, the N95 masks. So we're reaching out to businesses and corporations and manufacturing that might use N95 masks to see if we can access those stores. We're reaching out to other manufacturers, even in other countries, to see if we can get more stores of those masks. We have purchased ventilators from a manufacturer of ventilators in Pennsylvania. And so we will look at every opportunity to increase our supply that we will then pass on to hospitals and health systems to deal with the surge of patients.
From the morning call, Secretary, we are told that elderly and those with chronic conditions are more likely to need hospitalization for COVID-19. What chronic illnesses or underlying conditions are highly correlated with the need for intensive care?
So it is true that the elderly, that seniors, are more likely to have a severe case of COVID-19 requiring hospitalization and intensive care, particularly those with chronic medical problems such as heart disease, congestive heart failure, uncontrolled high blood pressure, those with diabetes, those with kidney disease, those with chronic breathing problems such as chronic obstructive pulmonary disease, those type of conditions. But I do want to emphasize, as we discussed yesterday, is that we are still seeing a significant number of young adults, so even in their 20s, 30s, and 40s, that have required hospitalization. So it is very younger adults not to be complacent. They need to practice social distancing, and again, please stay home.
And as a follow-up, a food service worker in Allentown Nursing Home has tested positive. Can you tell us how the state has responded to this so far as an intervention or increased scrutiny at the facility?
So I can't go into specifics about a single case in terms of patient confidentiality and privacy. But we are in constant contact with all nursing homes, including any nursing home in question. We have put out nursing home guidance in the last number of days to prevent cases and to deal with cases if they present. We are investigating this case and all other cases that have close contact with very sensitive populations, such as a nursing home, and we will do whatever is necessary to protect the residents and staff of nursing homes.
Secretary, Fox 43 would like to know how long does it take to get COVID-19 results? If it's 3 to 5 days, the numbers we're getting today would technically be from 3 to 5 days ago, correct?
Well, so there are a number of different ways to get tested for COVID-19 at this point, which is good because there's more ability then for people to get tested. We are still testing individuals at our laboratory in Exton, and we are testing and prioritizing specific groups of patients. For instance, people who might be in a sensitive area like a nursing home or a healthcare provider and such, or if there's a potential cluster. So we're prioritizing those tests at the Department of Health laboratory, and depending on what time the test gets there, we can either have the test the same day or at the most the next morning. So at the most, probably less than 24 hours. In addition, hospitals and health systems have developed their own testing capacity, specifically the Children's Hospital of Philadelphia, the Hospital of the University of Pennsylvania, UPMC, Allegheny, and others. And so I don't know the exact turnaround time at those hospitals, but hopefully it's within 24 hours. We'll have to check on that. We do know that some of the commercial laboratories have a longer time until we get results, such as LabCorp and Quest, and it can be a number of days. So you're correct. Some of those test results I'm reporting today, the samples were obtained a number of days ago, specifically for those commercial laboratory specimens.
We have 2 follow-up questions on testing from Sarah Ann Hughes from Spotlight PA. First, the Washington Post reports officials in some areas are urging people not to get tested in order to conserve limited PPE and testing supplies. What's PA's message regarding testing and the need to ration limited supplies?
Sure. So, as I was saying before, it might not be necessary. In fact, it is not necessary to test someone who has very, very mild symptoms, has no other predisposing chronic medical conditions, as I discussed, and is at home and relatively comfortable. Please stay home. You can contact your healthcare provider to discuss the situation. Take anti-fever medications such as acetaminophen or ibuprofen. Drink plenty of fluids and rest, and monitor the situation. And if things get worse, then seek health care and testing. We want to prioritize testing certainly to patients who have symptoms. We are not testing patients who have no symptoms. A negative test for someone who has no symptoms is really not clinically meaningful. they could be exposed the next day, or they could be in the first day or so of that incubation period, and the test could be negative. So we want to test symptomatic patients and prioritize healthcare providers, seniors, those with chronic medical conditions, and anyone else who's very ill.
And as a follow-up to that, are we seeing a spike in cases because there's better access to testing or because more people are infected?
We are actually seeing a spike in cases because more people are infected. And as we look at all of the case results coming in, the positives and negatives, we can see that. So the number of new cases is increasing at an exponential rate. We are doubling the number of new cases every 2 or more days, and it's not just increased testing.
And then another question on testing from ABC 27. Given that you're telling people to stay home if they have mild symptoms and the lack of test availability at certain sites, are you able to predict how accurate the numbers of positive cases are? Are we tens of cases off or hundreds of cases off?
So we don't exactly know, but we really do strongly feel that there is community spread, particularly in the hardest hit areas. And that includes the Southeast, that includes Allegheny County. And so we will have an underestimate of the number of new cases, which highlights the rate that it is changing even more. That is true, of course, with many illnesses, particularly the flu. And if people have mild symptoms, they don't get tested from the flu. We always say that the numbers, significant as they are an underestimate. And that would be true of an infection like COVID-19 as well. More important than the specific accuracy of the numbers is actually trying to prevent its spread in the community. And so by people with very mild symptoms staying home, we're very much trying to prevent the spread. For instance, if you go to the hospital, the emergency department, then other people in the emergency department could possibly be exposed. So the most important thing is to prevent and mitigate the spread of COVID-19.
We have a question from the Record Herald. Is it safe to eat takeout food prepared by an outside source, such as a restaurant, where we don't know the health of the workers?
Well, we will rely upon the good judgment of someone has active symptoms that, of course, they would not be preparing food for you. So I can't take away any risk, but it is certainly, if anybody is in the health in the food preparation industry, then if you have any symptoms whatsoever, please stay home so that you don't spread it to someone else.
And from Fox 43, if an essential worker is at higher risk, immunocompromised, and over the age of 65, should they not go to work?
I think that would be a discussion with the individual and with their employer. Outside of the healthcare industry or a life-sustaining business, we've asked those businesses to close and for those people to either telework or to stay at home. If that person is in a healthcare industry, they'll need to talk with their employer about whether they can work from home and telework or whether they need to come in. That'll be a decision with the employer and of the health facility and the individual.
From KYW News Radio, playgrounds in Philadelphia were shut down yesterday at 6 p.m. What advice do you have for families with young children living in small urban homes with limited outdoor space about how to cope? Many rely on public areas for outdoor green space.
It's a real challenging situation. And so, again, all of us are challenged by the social distancing that is required to prevent the spread of COVID-19. I think that's particularly true with families with young children. I would try innovative and creative ideas in terms of children, in terms of games, in terms of making games out of washing your hands and things like that, maybe cooking together. And if you can go outside and can maintain social distancing within your yard or your neighborhood, then that would be good. And I think that together, every family and all of us will get through it.
From Wallace McKelvey from the Patriot News, is the administration considering a shelter-in-place order similar to other states and localities? What would that look like, and what would trigger such an order?
Well, we are in those discussions with the administration and the governor, and we will make determinations over the next number of days as the situation requires. A shelter-in-place would be exactly that, and it would be implemented the way other states have implemented it, where we want people and emphasizing even more to stay at home. But those decisions have not been made as yet.
And as a follow-up, will the department be providing demographic, age, gender, et cetera, breakdown for current or future infections and deaths in the state? What is the current age distribution?
So we can provide broad demographic information. Actually, in terms of the most patients seem to be middle-aged adults, with seniors next and young adults next. So we can give you some broad statistics about demographics, but it's as I've outlined.
Then from Fox 43, what is the protocol for treating COVID-19 for a pregnant woman, and can it be passed on to the baby from an infected mother?
So this is a novel coronavirus, which means that it's never been seen before. And so a lot of that information isn't exactly known. A pregnant woman would be treated the way other people are treated, with supportive care. So with if she were very ill, with oxygen, with intravenous fluids and bed rest and medicines for fever, etc. And there is no specific antiviral treatment for pregnant women that I am aware of. We know from China is that a number of pregnant women delivered babies and they were fine and had no infection and had no sequela, no problems after delivery. But the world will be gathering that type of data as the epidemic continues.
From the Pittsburgh Business Times, how many counties in Pennsylvania have no intensive care beds or the kind of care that needs to be given in this pandemic? What are the plans for those counties?
I don't have that specific data about counties with no intensive care beds, but we'll be analyzing that. If a patient is in for instance, a rural county where the hospital doesn't have an ICU, if they required ICU care, then they will be transported to a medical center that does have the ability to do ICU care. Of course, all the people involved with transport, the EMS and the paramedics, etc., would all have to have personal protective equipment to avoid exposure, and so then the patient would be transferred. So as the Pennsylvania Department of Health works with PEMA, with hospitals, health systems, with HAP, then we will be determining those patterns of transfer if necessary.
We have several questions about testing ability, and when will mobile drive-through testing without a doctor's recommendation be available? Any details for plans in place to increase testing availability?
Well, so we have increased testing availability over the last, now just coming on 3 weeks, significantly. So tests can be obtained and sent to our public health laboratory. Again, we're prioritizing those tests to sensitive populations, to particular healthcare workers, to check on any potential cluster or outbreak of COVID-19. And then under doctor's orders, many hospitals and health systems have testing stations or pods where tests can be done. Of course, tests can be done for critically ill patients in the emergency department. And right now in Philadelphia and in Montgomery County, there is drive-through testing. This is part of the federal program to expand testing. And so collaboration with the county health departments as lead in Philly and Montgomery County, and then the Department of Health, PEMA, and the federal government has that type of drive-through testing. But they are prioritizing testing individuals with symptoms. For those drive-through testings, you don't need a doctor's order. Other areas, you do need a doctor's order, so you'd have to contact your healthcare provider. We are discussing with other health departments, such as Allegheny, and then have discussions with the federal government where we can do any more of those drive-through testings, and we'll have those discussions.
There's a question from PLS Reporter. Has there specifically been any actions to boost capacity in rural areas, given that these parts have older populations on average, and fewer beds in the first place to cope?
So we're going to be working to increase bed capacity everywhere. So there are 3 phases to our plans. The first is to use our conventional health system, the hospitals themselves, and hopefully most patients can be treated there. If the system can't handle the demand, we would implement contingency measures that hospitals have those contingency plans, adding more hospital beds, adding some additional facilities. We're looking about maybe less sick patients could be at ambulatory surgical facilities, could even patients, if they don't require acute care, so subacute care, as they convalesce, be in hotels or something like that, and then transfer when needed. So our goal will be to is to put together all of those plans, again, with the hospitals, the health systems, the county municipal health departments, and the hospital association, so that we have an integrated network to take care of ill patients with COVID-19.
Pennsylvania Capital Star would like to know, is the Department of Health aware of any post facto tests of old flu swabs for COVID-19?
So I am not aware of testing old swabs that were used for flu for population-based testing. That might be occurring under the auspices of the federal government to look at sort of population-based statistics, but we're not doing that.
Can you please address the nursing license requirement suspension to assist in the COVID-19 response?
Well, we're working with the Department of State in terms of making sure that we have adequate staffing for individuals. So, for instance,
I'm impressed and heartened by the speed and bipartisan spirit that has characterized the past day's discussions, but we need to keep it up. We absolutely cannot let up now. We need to finish these negotiations and move forward.
Under the previous order, the leadership time is reserved. Morning business is closed. Under the previous order, the Senate will resume consideration of the motion to proceed to H.R. 748, which the clerk will report.
Motion to proceed to H.R. 748, an act to amend the Internal Revenue Code of 1986 to repeal the excise tax on high-cost employer-sponsored health coverage. To repeal the excise tax on high-cost employer-sponsored health coverage.
I suggest that.
Clerk will call the roll.
Mr. Alexander.
That's like 10 or 11 years ago. Oh, good.
Hey, bud. Okay. Okay.
Mr. President,
The Assistant Democratic Leader.
I ask consent the quorum call be suspended.
Without objection.
Thank you, Mr. President. Mr. President, each of us receives a report almost on an hourly basis from our home states. And at the end of the day, my state of Illinois sends a report on the latest situation involving this COVID-19 virus. 163 new infections were announced yesterday. That's the biggest one-day jump that we've had, and one additional death. Governor Pritzker has issued a stay-at-home order for the state of Illinois today, beginning Saturday today at 5 p.m. until April the 7th. The city of Chicago is closing its parks and libraries as well, starting today. The Veterans Administration has reported one confirmed veterans case with the virus in the Chicago area. That person is now under home quarantine. We had an exceptional situation at Midway Airport where two FAA tower employees tested positive for the virus several days ago. We, of course, have to have an abundance of care and caution for the remaining employees there. And so the FAA, together with the City of Chicago, has been involved in screening the other employees and also determining whether the workplace has been cleaned properly before anyone goes back to work. The net result of it has been Southwest Airlines announced suspending its flights into Midway Airport because of this tower situation. When I spoke to the head of the Federal Aviation Administration, he told me there was a similar challenge at another major airport. I'm afraid we haven't heard the last of it. It's an indication of what happens when someone tests positive in a work atmosphere that is a critical part of our economy and the safety of our nation. So our hope is, fingers crossed, that this tower may resume its activities in the early part of next week. But we want to make sure when we do that all the employees are going to be safe in their workplace. We are also laboring in Illinois, as many states are, with the problem of not adequate testing. We just don't know the extent of the infection. I mentioned the numbers that were reported yesterday, but that is based on a very small sample of tests that are being taken. We still have not received the test kits, and those that we have, some of them cannot be used because they don't have a necessary reagent or chemical that is part of the collection process. It turns out we are dependent on a foreign source for that chemical. In ordinary times, it was never a problem, but in extraordinary times, it is. I've joined with Senator Alexander, Senator Blunt, and Senator Murray, asking the National Academy of Sciences in the midst of this crisis to step back, get to altitude, and look down on the United States dependence on foreign-made medicines, medical equipment, and medical devices, and to determine whether or not we need to reassess that dependence. In the ordinary course of business, there's no problem, things traveling back and forth between the United States and foreign countries. But in this situation, where there's a public health crisis that's interrupted ordinary trade patterns, or in the future, if we anticipate a similar challenge because of terrorism, we have to think ahead. I hope the National Academy of Science will give us their analysis of the situation as it currently exists and some guidance about how to look to these issues in the future. It is critical that we do. We also know that we have problems relating to our hospitals. One of the things which we have urged Senator McConnell to consider, and Senator Schumer has used the term a Marshall Plan for our hospitals, I think is absolutely essential. Yesterday I had a conference call with 30 or 40, maybe more, hospital administrators in the state of Illinois. I want to just share some of the thoughts that they gave me yesterday in the course of this conversation. This is with through the Illinois Hospital Association. What we need, they said, is a immediate infusion of funds. We need access to critical supplies. We need surge capacity. There are 300,000 hospital workers in Illinois. At this point, they need the protective equipment that is lacking in so many areas. It turns out that our federal stockpile, whatever it's worth, was either not large enough or cannot be distributed fast enough to meet the needs of these hospitals. One of the hospital administrators, I'm not going to name the individual hospitals, but one of the hospital administrators of a major hospital in Chicago said, we're worried about a shortage in ventilators. And I've heard that over and over again. They also want to let us know that these hospitals are taking huge financial hits today. We know about the restaurant industry because we see the closed restaurants, and we can imagine all the workers inside not reporting to work and trying to make things work for their families and the circumstances. But we don't appreciate the fact that because of this COVID-19, many of our hospitals have seen a significant reduction in their revenue streams. As one of the hospital administrators told me, he said, our outpatient clinic work is down to a minimum, and elective surgeries are being put off for obvious reasons. That is 50% of our revenue at the hospital. And so we have a revenue issue going into this. They urged me through Medicare and Medicaid to increase reimbursements, and based on preliminary bipartisan discussions yesterday, I believe that that is being considered, that both Medicaid and Medicare would increase the DRGs, for example, which is the reimbursement mechanism for those treating COVID-19 patients. Their concern, and they told me this over and over again, is that at a moment when we need our hospitals more than ever, many of the hospitals are facing closure because they just don't have the funds necessary to keep the doors open. The ordinary sources of revenue and profit have been pushed back and reduced. There are a variety of proposals that came to us in terms of making these federal funds available, but they urged me over and over again to do this as quickly as possible and not to establish some long, involved bureaucratic process for applying for these funds. We also talked about the money flowing directly to the hospitals rather than through state governments or through some federal agencies. I know that this is risky business when it comes to accounting, but at a time of a national economic and public health crisis, I personally agree with them. I think we have no choice. I went through the hospitals and they talked about their liquidity and cash problems, and they said you need to treat this like a FEMA emergency. There are responses using hospitals in those emergencies that cut through the red tape and get the money to the places needed as quickly as possible. We have to do exactly the same thing. They talked about the number of infections growing exponentially, and they've also talked to me about one rural hospital which literally said they were within days of closing. And I can tell you, in that area of the state, a rural part of the state of Illinois, it means that patients facing any medical challenges will have long distances to travel to find a place to be treated. So we can't let that happen if it's at all possible to save these hospitals. The overseas supplies, they understand, are coming in. Many of them are desperately needed. They've asked if there's any way to expedite that by the use of cargo air that may not be utilized in the ordinary course of business because of our economic situation. We are looking into that. I could give more information, but I won't. It's pretty obvious. The first line of defense for us in this public health crisis will be our hospitals. That patients through telemedicine can be at least counseled and diagnosed, and we can avoid people coming to emergency rooms unless it really is necessary. I understand the impulse we all have. Someone we love feels sick and appears to have the symptoms. We want them tested immediately, treated, but we have to take care and heed to advice even when it is hard. Telehealth is a way for us to have a better diagnosis of those in long distances and perhaps to counsel them that an immediate trip to the emergency room is not necessary. I hope we can reach that point. We are also concerned about extension of facilities. Currently, the major hospitals in my state are looking to the expansion through tents, the kind of emergency shelters that might be available so that people can be separated from one another. Yesterday, I spoke to the Secretary of the Army, Mr. McCarthy, about the availability of Department of Defense expertise. The Department of Defense can step into a situation and very quickly convert hotels into hospital-type arrangements. They can take closed hospitals and put them up and running in a very quick order. I think that expertise is desperately needed, and I've encouraged the Secretary of the Army and the Secretary of Defense to make that expertise available. We're connecting up right now between our state and the experts at the Department of Defense. These are men and women who do this and are prepared to do it at a moment's notice if our military men and women are in peril. I would say at this point, America is in danger because of this, and we should turn to their responses and help as quickly as possible. Mr. President, I want to say one thing about a statement made earlier today by both Senator Schumer and by Senator McConnell. We have before us an opportunity, and I hope we seize it, to show that we can continue the bipartisanship that leads us to this moment. The first two bills that addressed this COVID-19 or coronavirus threat to America were handled in an extraordinary way, and perhaps to the surprise of many Americans. They were done on a bipartisan basis and on a timely basis. Now, we have only had the Republican proposal for a little over 24 hours, but I can tell you that as soon as it was received, active negotiations were undertaken at all levels. I sat through many of them yesterday, and they were done in good faith. There are differences clearly in policy. We are really writing these bills as we travel down this path, this dangerous path. And so it's important that we do it in a timely way, but also exercise good judgment. My concern is now that we get this done and done this weekend, because if we can finish this bill in a satisfactory way to both Republicans and Democrats and report it to the House when they return next week, they'll be able to take it up and move on it quickly. There are so many Americans who are desperately waiting for a word from Washington as to what their future will be, first in terms of medical care, but second in terms of keeping their families together in difficult times. I am not opposed, nor have I heard anyone opposed, to providing financial assistance to individuals and families that really need it. We want to do that. I know the presiding officer has been a leader on this issue as well. But we also are hoping that we can include in this some guarantee that it won't be one and done, that it isn't just a matter of providing this one check and stepping back and waiting for the consequences. We know that many people are facing long-term challenges and need a medium to long-term commitment from us to make sure that their families can stay together during this difficult time. I believe we can, we should. Let me close, Mr. President, by saying that this is an exceptional time. We are isolated in one respect, but closer. I think we all have come together in ways unanticipated. I've been in 2 FaceTimes and Zoom apps this morning with members of my family, and we're doing this now almost on a daily basis. I feel more connected now in one respect than usually the case, and it's because we all care for one another. And it goes beyond families. I really believe that that sentiment is shared across America. We've got to keep it alive. Despite our political differences, despite all the things that separate us, there is so much more that brings us together and so much that unites this country. We've got to depend on that strength now more than ever. This is a challenge the likes of which we have never seen in our modern history. We can rise to this challenge as we have so often in the past, and I know we can do it in a unified way, bringing this nation together. Mr. President, I yield the floor. Suggest the absence of quorum.
The clerk will call the roll.
Mr. Alexander.
Yes, we're down less than that now. Of course, with members of the task force are here, we expect the president, vice president, both one of them coming any moment now. So obviously, this is of great interest because we want to know what the latest developments include. Among those who are here today, of course, Peter Navarro, who is the trade representative. We see Dr. Anthony Fauci, who has been a part of so many of these briefings, our HUD secretary, and so forth. And we'll await hearing more from the president, vice president in the next couple of minutes. I'm going to take my seat so as to not get away. Thanks, Alex.
Mr. President.
Good
morning.
Well, thank you very much. A lot of things going on. We're going to be going over to the Hill, and we're having a lot of meetings. And from the financial, this is a medical situation, not a financial situation. The financial, though, is moving along very nicely. I want to thank you for being here and update you on the progress we've made after a week of extraordinary mobilization in our war against the virus. Governors, mayors, the businesses, charities, and citizens are all working with urgency and speed toward one common goal, which is saving American lives. We're in communication with foreign countries. It's now at 148 foreign countries. Can you believe that? 100, you talk about a spread, you talk about a violent spread, 148 countries. Not even believable. There's been a week of national action and of great national solidarity. People are getting along. We're getting along with Republicans and Democrats and independents and liberals and conservatives, and actually it's a very nice thing to see. We're all one beautiful, big American family, and that's taking place right now. Last night, I approved a major disaster declaration for the state of New York. Worked very closely with Governor Cuomo. And this is the first time in our nation's history that a president's used the Stafford Act to declare a major disaster in response to a public health crisis. Never happened before. I'm considering other areas where we may or may not be doing that, and I'm working very closely with Gavin Newsom, governor of California, and others. We may be doing the same thing depending on their needs, depending on what they're asking for. It's been unprecedented action in New York, and we've had a tremendous federal response all over the country. And I want to thank all the people in the federal government and obviously in the state governments and local governments. We are working hard. Everybody is working hard. And the people are working very hard. That I can tell you. We'll reach agreements with Canada and Mexico on new travel rules at our northern and southern borders to halt the entry of the Chinese virus while continuing trade and commerce. And we've had very good talks. With Prime Minister Trudeau, and today, this morning, with President Lopez Obrador. And we talked about joint measures that we're taking to prevent the spread of the virus in our countries and to temporarily suspend non-essential travel. We had a great conversation this morning, President of Mexico, and our close cooperation with Mexico and Canada will keep our people healthy, keep their people healthy, keep everybody safe. Yesterday, I had a call with 12,000 small businesses, representatives of these businesses. That's the engine of our country. People don't realize that. You know, you read all about the big ones, but these small business, when you add them up together, are really the engine, economic engine of our country. And I assured them that my administration is doing everything within its very considerable power, frankly, to support them and their employees. Nobody's ever done what we've done. Likewise, I had calls during the week with all sorts of representatives and systems like the hospital system. We spoke to many of the hospital systems throughout the country, nurses and doctors, representatives representing hundreds of thousands of nurses and doctors, airlines and cruise ship companies, the Business Roundtable, which was fully attended, and it's all of the top CEOs of our country and beyond, frankly. The businessmen of, really, these are world-styled businessmen. These are businessmen that control the biggest companies in the world. Many of them have taken hits, and many of them are just, going forward. Their businesses have been great. Some have been very badly affected. Some haven't been affected at all, and frankly, some are doing very well. They continue to do very well. It's Walmart, as an example, has been Doug McMillon, head of Walmart, really helpful to us, and I guess I assume they're doing pretty well because people are certainly buying more than even a clip at Christmas by substantial numbers. Pretty amazing, but they're doing incredibly. They put on tremendous extra staff. You don't have empty shelves. A lot of things have happened that are very good. Restaurants, fast food executives, grocery stores, all retailers, literally all of them, in groups. And we spoke with the G7 leaders at length, as you know. You probably know about that. Spoke to many of the governors, spoke to almost all of the governors at conference calls and many of the governors individually. And very importantly, the religious leaders. We had a great conversation yesterday, the Vice President and myself, with the religious leaders of our country, many of the religious leaders, and we've had a number of them during the course of the last 2 weeks, actually. But yesterday we had a very significant call with the religious leaders of our country. I signed legislation providing American workers with paid sick leave and paid family medical leave at no cost to employers, and free testing for those who need it. The testing is going very well, and the Admiral will speak to that along with Tony. We're working quickly to pass additional legislation that will provide massive relief to small businesses and affected industries and give direct payments to our great workers and hardworking American families. There's never been anything like we're doing on the Hill right now. They're negotiating. Mitch McConnell, Chuck Schumer, they're all up there. Kevin McCarthy and Nancy Pelosi. They're all negotiating, and everybody's working hard, and they want to get to a solution that's the right solution. I think we're getting very close. We've also announced that we've moved tax day from April 15th to July 15th, which is a big deal, giving businesses and individuals extra time to file and pay without interest or penalties. So we've moved the date way back, and so it'll be July 15th instead of your traditional April 15th. And very important, you will have a lot of time, but you're not going to have interest penalties or any kind of penalties by filing at that later date. HUD announced that foreclosures and evictions are suspended for single-family homeowners with FHA-insured mortgages for the next 60 days. And our great head of HUD, who's with us today, Ben Carson's going to say a few words in a moment. The Department of Education will not enforce standardized testing, which is another big deal, requirements for students in elementary through high school for the current school year. Not fair to do that. So we are waiving that. I would imagine it's probably the first time ever that's been waived, but I think it's only fair to the students and to the parents of the students. It is also waiving interest and other things that we're discussing right now on federally held student loans, and directed that borrowers be allowed to suspend their student loan payments without penalty for at least 60 days. And we'll going to help the students. They're under a great burden right now, so we will be talking about that further. But we're waiving during the 60-day period various elements and very important elements on student loans, big subject. I signed an executive order invoking the Defense Production Act, as you all know, giving us powerful new authorities to help states, cities, and hospitals procure needed supplies. There's been a clear call to action to the private sector, and the call is made right here. It's been really pretty amazing what's happened with the private sector. They are really in sixth gear, I think, which has responded in full force, helping to produce and supply much-needed masks, swabs, sanitizers, ventilators, and there's a move on that's incredible right now. And by way of example, Hanes, everybody knows Hanes, great company, great consumer cotton products company, is retrofitting its manufacturing capabilities in large sections of their plants to produce masks. And they're in that process right now. And in my direction, the FDA has taken rapid steps to make these items available for medical use right now. I mean, most excitingly to me is what the FDA has done in order to get possibly a very successful number. It's not just one or two, number of therapeutics, medicines that can help people that are already sick, help people not get sick. And obviously, you know about the vaccine, and Tony will discuss that a little bit later, but the vaccine is moving along. But this is something that right now, this is what it's incredible. And what the FDA has done, and Dr. Stephen Hahn, who's highly respected, came as just a highly respected man. He's been fantastic. He's only been here for a couple of months, and he's gotten thrown into the swim of it, and he's really standing up. But the FDA has really moved mountains. I said it this morning. They moved mountains to get approvals on things that maybe work. We'll find out very soon. It won't take long. An example of the Pernod Ricard, which is this is really an example where we're repurposing alcohol. They went out and repurposed their alcohol production capabilities in Arkansas, Kentucky, Texas, and West Virginia to make hand sanitizer. That's a big difference. And they've been unbelievable. They really have. Pernod Ricard. Their first delivery will be on Tuesday. It's going to go to various states. They're going to start, I think, in New York, and they're going to work their way around. They're making a tremendous amount of hand sanitizer at a very high level, too, by the way. We've activated the National Response Coordination Center to level 1, that's your highest level. This is the nerve center of all of our government response to crisis, and it's coordinating very closely with our nation's governors. Our nation's governors, many of you were at the call yesterday with the governors, and I think you can see the relationship, and we've had numerous calls with governors, by the way, but the relationships are pretty amazing. They're loving what we're doing, government and the governors, states, and even local. The coordinate, pretty incredible. FEMA Administrator Pete Gaynor, who is with us, will soon be providing you with an update on the center's operations, and FEMA's been incredible. We got them involved last week, very much involved, and now they're involved nationwide. We've dramatically expanded telehealth so Americans can see a doctor without leaving home, something which more and more people are using, and now they're really using it, and now the ones that are using it are loving it. And I think we're going to change the way our country functions medically and probably in other ways because of what's going on right now. This will reduce the chance of infection and preserve hospital capacity, so it solves a lot of problems. Every American has a role to play in defending our nation from this invisible, horrible enemy. It really is. It's an invisible enemy. And we will be successful, very successful, hopefully very much sooner than people would even think. So we say states, there's a time of shared national sacrifice, but it's also a time to treasure our loved ones and to take stock of what is most important, our faith, our families, our neighbors, and our great country. And I want to thank all of the incredible people of our country, the citizens of our country, that what you've done and the way you're responding has just been very special. We will never forget, that the history books will never forget. We're going to have a great victory. We're going to be celebrating a great victory in the not too distant future. And I just want to thank everybody. And now I'll introduce our Vice President, Mike Pence, who's led the task force. And I will tell you this, he has not slept much, maybe a tiny bit, maybe a little bit, but not much. And he's done an incredible job. Mike, thank you. Please.
Good afternoon, all. And thank you, Mr. President. The White House Coronavirus Task Force met today. We briefed the President on our latest recommendations. We continue at the President's direction to lead not a whole of government approach, but a whole of America approach. You just heard the President describe one inspiring story after another, the way the American people are responding, the way American businesses are responding, religious communities across this country. The American people are coming together. They're responding with common sense, compassion, and generosity. People are heeding the advice of state and local authorities, and tens of millions of Americans are putting into practice 15 days to slow the spread. We are officially, Mr. President, 6 days into our 15 days. And as we look all across this country, while we strongly support the decisions that governors in states where we have significant outbreak have taken, we encourage every American to listen to those state and local authorities. For every American, this is what you can do to make a difference over the next week and a few days to protect your health, protect your family's health, but most especially slow the spread and the potential for the coronavirus to impact the most vulnerable. As the President said, we've almost been overwhelmed at the outpouring of support from American businesses. The President spoke yesterday to thousands of small businesses. We spoke to manufacturers yesterday. And in fact, as the President indicated, the FDA in record time just approved one manufacturer that will be producing millions of surgical masks in a matter of weeks for the American people. The pastors we spoke to, we want to thank all the religious leaders from every community of faith in the country, making the hard choice to suspend services, to have online services even while those ministries are continuing to support food banks and come alongside the most vulnerable. And of course, the chorus of prayers that is coming up from communities of faith around the country is making the difference that it always has in the life of this nation. One thing the President and I promised was to remind people that on the weekends that you're not in the pews, it's still a good idea to, if you can, to go ahead and make that donation, because all the ministries are continuing to play a vital role in our communities, and we encourage your continued support. The President and I are grateful that the American people are listening to state and local authorities and putting into practice all of the recommendations in the President's coronavirus guidelines. As you will hear in just a few moments from Admiral Gua, testing is expanding rapidly across the United States of America. State-run drive-thrus are expanding across the country. And as you will hear detailed this morning, now more than 195,000 Americans and more who have been symptomatic have been tested. That number does not include county hospitals or healthcare labs around the nation, some 15,000 in number. And among the number of the more than 195,000 that have been tested, it's important to remember that only 19,343 at this moment have tested positive for the coronavirus. We continue to urge state and local health authorities to contact FEMA for all the latest developments and innovations in testing. But we want to remind Americans, as Dr. Fauci will emphasize in a moment, if you don't have symptoms, don't do a test. It is another way that the American people can make sure that we are preserving the resources that our healthcare workers need to minister and to support those who are dealing with the coronavirus and other illnesses. In a moment, Pete Gaines, the efforts at FEMA since the President's national emergency declaration. We have FEMA in the lead, stood up the National Center as the President said, and we are working closely, literally hour by hour through FEMA, processing requests from states most impacted like New York, Washington State, and California, and we'll continue to work very, very closely with those states through the very traditional means of federal emergency management at FEMA. Secretary Carson will describe decisive actions the President alluded to bring foreclosure relief to Americans. And on the subject of supplies, in a moment, you will hear of not only the progress that we're making on testing, but on Monday, we'll be detailing for the American people the progress that we are making on the President's strategy of personal protective equipment and medical supplies, allocating them through the system of FEMA, and continuing to urge conservation by Americans. In fact, I'm pleased to report to the President today that HHS just placed an order for hundreds of millions of N95 masks that will be being made available to healthcare providers across the country. On behalf of the President, we do renew our call for Americans to postpone elective medical procedures, including dental services. And remember, this is another way that you're going to make sure that medical supplies are available, because by postponing elective medical procedures, you're freeing up medical supplies for those dealing with the coronavirus. As the President mentioned, our team is on Capitol Hill as we speak, working with members of Congress in both political parties. They're making progress, by all accounts, on a bipartisan bill. They worked late into the night last night, started early this morning, and we are working to pass that legislation on Monday in both the House and the Senate. Now, on a personal note, many of you may have been made aware that a member of my staff has tested positive for the coronavirus. We learned of that late yesterday. I am pleased to report that he is doing well. He had mild cold-like symptoms for about a day and a half, has not been to the White House since Monday. Neither the President nor I had direct contact with that staff person. We worked immediately with the White House physician and the CDC. We've done all contact tracing. And while the White House doctor has indicated that he has no reason to believe that I was exposed and no need to be tested, Given the unique position that I have as Vice President and as the leader of the White House Coronavirus Task Force, both I and my wife will be tested for the coronavirus later this afternoon. Let me say again how grateful the President and I are that every American has acted on the President's coronavirus guidelines. We are 6 days into 15 days that, as Dr. Fauci may well reflect in a moment, is an opportunity for us here on the footholds of this epidemic curve in our country to literally lower the impact in our nation and save lives. Every American can do their part to slow the spread, and we encourage you each to continue to do that. As the President says often, remember, we're all in this together. And also remember that for most Americans, the risk of serious illness from the coronavirus remains low. The reason we want to put into practice the President's coronavirus guidelines is because no American would want to inadvertently expose someone who is vulnerable, a senior with a serious underlying health condition, to the coronavirus with a potential threat. I did hear one story this morning, Mr. President, about a senior named Geneva Wood. She actually is at the Life Care Center in Kirkland, Washington. She is not only a grandmother, she is a great-great-grandmother, 90 years young, and she tested positive for the coronavirus on March 6th. But by all accounts, she's doing well. She wanted America to know there is hope, and her strength and her enthusiasm is truly an inspiration to the nation. As the President said many times, we're going to get through this and come out stronger than ever before. And we'll get through this as Americans together. Thank you, Mr. President.
Thank you very much. Thank you, Mike. Admiral, please.
Thank you, Mr. President, Mr. Vice President. As I told you earlier last week, we are in the process and are effectively transitioning to large-scale testing by leveraging all the components of the American healthcare system. When we started, it was CDC only. Then it was the state public health laboratories. Now we're transitioning into the mainstream of American testing with many of the companies that the President invited in the Rose Garden just. So currently, 91 public health laboratories, state public health laboratories, are up and running in 50 states, the District of Columbia, Guam, and Puerto Rico. This is our curve, and I want to be very clear about this, that this only accounts for CDC, state public health laboratories, and the laboratories that are members of the American Clinical Laboratory Association. These are the main reference laboratories: LabCorp, Quest, Mayo, ARUP, BioReference Labs, and Sonic Healthcare. It does not account for the well over 10,000, 15,000 hospital-based labs, many of which are doing testing, for whom we will get data this week to give you an overall roll-up. As you can see, over 195,000 people in America have completed their testing. That means tests plus results. This does not count the people whose tests are in process. And as you see, this curve is going, it will continue to rise dramatically over the next period of time. So again, this is utilizing all the components of the great American healthcare system, the state and local public health laboratories, the hospital system, which is not represented here, and the main reference laboratories. Now, I do want to make it clear that although testing is becoming more available, and Dr. Fauci will definitely emphasize this more, there are priorities for testing. And clearly, everyone across the country should understand that those hospitalized or in an ICU are a priority for testing. Symptomatic healthcare workers, for obvious reasons, we want to make sure that their health is preserved and that they are not going to spread to those who may be seriously ill. Symptomatic people in long-term care facilities. As the Vice President has highlighted, and we've said many times, elderly in our society have a much higher mortality rate, much higher serious complication rate. Symptomatic individuals over 65, symptomatic individuals who have underlying conditions like chronic heart disease or liver disease or other types of chronic diseases, patients in public health investigations, and there are local priorities around the country, particularly healthcare workers for testing. And Dr. Fauci is going to emphasize this about the types of people who may not be to be tested. Testing is going well, it's ramping up, but we should still have priorities. Finally, I want to talk about the community-based testing sites. I know they're popular now because there's now an acronym, which I'm sure the Vice President doesn't appreciate, CBTS, or CBT sites. We talked about these earlier in the week, and I wanted to emphasize again that these are state-managed and locally executed. The federal government is there to provide support, know-how, blueprints on how to do this, but these are really springing up at dozens and dozens of sites all over the country, adapted to the local needs. Some are drive-throughs, some are walk-up, some are geared to healthcare workers and emergency responders. So again, what we see in the upcoming week is this curve will continue to increase as testing becomes more widely available, as the great American healthcare industry continues to increase the availability of tests and the throughput of those tests. Thank you, sir.
Thank you very much, Edwin. Dr. Fauci, please.
Thank you very much, Mr. President, Mr. Vice President. What I want to do just over the next minute or so is maybe connect some of the dots of the things that you've heard today. First, the status of the dynamics of the outbreak. I mean, you all know the numbers. You've seen them. We have widespread infection, but to varying degrees throughout the country. So, for example, when you talk about the kinds of mitigation issues that we have put forth and have emphasized, just as I mentioned the other day, there are two dynamic forces that are going on at the same time. You're having the natural course of an outbreak trying to peak at a high level, and then you have the mitigation strategies which are aimed at dampening that. We've mentioned that multiple times. We often get asked, how do you know you're having an effect? Because there are two things that are going on at the same time. They may be confounding. Well, I can tell you for sure, from a public health standpoint and experience with other outbreaks, we know we are clearly having an effect, but we can't quantitate it for you accurately now, because looking forward, you'll know what the impact of the rate of these steep inclines will be. So that's why we're going to come back to you every day and keep you up to date about that. Getting with regard to the disproportionate of the response, everyone, it's right here, I'll open up the Vice President's book with his permission. This is baseline for everyone. In other words, throughout the country. But then there will be areas, and you've heard them, Washington State, California, New York City, in which the dynamics of the outbreak are clearly different and much more robust, if you want to use that word. And that's the reason why we've seen the mitigation ratcheted up in that regard. And again, hopefully, and I have confidence it will happen on that. Next, getting to testing. You saw the numbers with testing. Remember, there was always an issue with testing. I think we're getting to the solution that everybody in the country is looking for. But I want to emphasize one thing that Admiral Giroir mentioned, is that not every single person in the United States needs to get tested. He gave you the priorities. I don't want to repeat them. But let me tell you one of the unintended consequences of individuals who don't need to get tested that flood the desire to get tested. Currently, and I hope we'll be able to change it and make it much less reliable on PPEs, when you go in and get tested, you are consuming personal protective equipment, masks and gowns. Those are high priority for the healthcare workers who are taking care of people who have coronavirus disease. So what we don't want to do is to have a situation where we do have disparities in availability of PPEs now, and we're working hard to correct that. But currently today, we want to make sure that the people who are taking care of people with coronavirus disease do not endanger themselves because they don't have the personal protective equipment. And then finally, one last thing was just mentioned. The Surgeon General has been pushing this. Please put off, cancel elective medical and surgical procedures. You don't want to not ever do them, but for the time being, don't do them, because they also not only consume personal protective equipment, they may also consume some of the things like ventilators that you might need. So let's pull in this together, and we will get through it. I promise you. Thank you.
Thank you, Tony, very much.
Thank you, Mr. President, Mr. Vice President. FEMA is now leading the federal operation or the federal response for all operations on behalf of the White House Coronavirus Task Force, who oversees this whole of nation response. HHS will continue to provide their expert matter expertise on health, and pursuant to the nationwide emergency declaration, FEMA, in coordination with HHS, is assisting state, local, tribal, territorial governments and their other eligible entities with health and safety emergency protective measures on behalf of the American public. As of yesterday, 50 states, the District of Columbia, 5 territories, and 1 tribe are working directly with FEMA under the nationwide emergency declaration for COVID-19. In just 24 hours, we've obligated $100 million to states, territories, and tribes. A little bit about supplies. It is of the utmost importance that requests for assistance, especially for critical supplies, get routed through proper channels as soon as possible. And we ask everyone to follow the normal procedures FEMA uses in a natural disaster. There's no different procedure for the COVID-19 pandemic. But remember, you can still order supplies from your regular vendors and buy it on the open market. Buy it where you can find it. We will reimburse you. If you buy medical supplies from foreign sources, it is reimbursable. Buy America does not apply to the Stafford Act, except for Washington, D.C. and Puerto Rico. If you can't buy it on the open market, make a request through the FEMA system. Requests for assistance at the local and county level should first go to states, from states to the regional FEMA offices, and then from those offices right here in D.C., where the National Response Coordination Center is open and running. We are getting requests for masks, PPE, swab sets, test site supports, ventilators, hospital capacity assessments, and many more. We are in lockstep with HHS to answer these requests, but we will do whatever is necessary to get states, tribes, territories, and others what they need. And then finally, what we are doing here in Washington, D.C., again, this is a whole-of-government response. Like all emergencies, response is most successful when it is locally executed, state-managed, and federally supported. We can't say that enough. On Thursday, our federal partners fully integrated with our National Response Coordination Center, and additionally, all 10 FEMA regions across the country have been activated. The FEMA regional administrators will continue to coordinate closely with governors, state emergency managers, state public health officials to determine the type and level of support needed to respond to this dynamic threat. Thank you, sir.
Thank you very much, Pete. Appreciate it.
Ben.
Ben, please.
Well, thank you, Mr. President and Mr. Vice President, for your tireless leadership here. And I also want to thank the fellow task force members who have been working around the clock in a very patriotic way to serve their fellow Americans. You know, part of the American dream is having a home. And sometimes people say, well, what does housing have to do with health? It has everything to do with health, having a safe home. And that is the reason that the President has authorized the immediate cessation of foreclosure and eviction proceedings for American citizens, single-family forward mortgages, as well as reverse mortgages. And as you know, FHFA has also decided to do the same thing for 60 days. And the CFPB is very happy with all of this as well. And it's really all about helping our people, recognizing that they're being severely impacted by the coronavirus. And we've also asked the various servicers of mortgage loans to exercise forbearance for anybody who's having difficulty. It is important, if you're having difficulty, to actually contact the people who have made the loan, who established the mortgage, because it doesn't happen automatically. What does happen automatically is that we cover all 8.5 million people in terms of the moratorium on foreclosures and evictions. We want also for the PHAs to be protected. HUD does not have authority to mandate that evictions can occur, but we are in contact with all the PHAs across the country and are petitioning Congress for the power to be able to actually enforce that. But the fact of the matter is most of the PHAs are run by people who actually care about other people. So we really haven't seen much of a problem there. We haven't seen much of a problem with forbearance and needing to try to force people to do it because they want to do it. People are stepping up and saying, what can we do to be helpful? As far as housing choice vouchers, Section 8 is concerned, the April vouchers will be sent out next week. May vouchers are already being worked on. And we're also staying in contact with all the stakeholders, the advocates for low-income housing, as well as other stakeholders, to make sure that we're doing things that are most helpful to them. And additionally, we've extended the deadlines for healthcare and multifamily financial reporting requirements. And that's for over 20,000 multifamily and healthcare borrowers until April the 30th. And that provides them with a lot more flexibility to deal with the issues that they're dealing with. I also want to thank our FHA Commissioner Bryant Montgomery, as well as the FHFA Director Mark Calabria, and Kathy Kraninger, the Director of CFPB, who've all worked tirelessly with us to make this happen. What we're trying to do is bridge the gap, recognizing that it's a lot easier for us to take these measures and for Congress to take the measures that they're taking so that we don't destroy a very excellent system and have to start all over again. So for those who are worried about the money that's being spent, if you don't spend the money and deal with this now, it's going to cost a whole lot more to try to build all this up again. And as was mentioned by the President, there's been a sense of unity that we haven't seen for a long time in this country. And let's hope and pray that that unity lasts far beyond this crisis.
Okay. Ben, thank you very much. A few questions, please.
Mr. President, a few questions, if you don't mind, sir. If you've lost your job now, or you're worried that you're going to lose your job tomorrow, restaurant, something like that, what do you want people to do immediately? The second question, sir, we heard from the Vice President that he's going to be tested. Have you taken a test since last Saturday? Okay. I guess
I hope I look good.
You've taken one today. I know you told us.
I just took one.
You just took one. How are you feeling?
Those people are going to be...
You took the one, sir? Sorry, hold on. Yeah.
So, the one test.
Okay, so for those people that have lost their job already, or they're worried that they're about to lose it tomorrow, what do you want them to do right now?
Well, what they do right now is keep receiving their paycheck, and hopefully their companies are going to be in a very strong position. We want to keep everything together because we think we're going to have a tremendous bounce back. Now, some people agree with that very strongly. Some of our top economists, they think we're going to have once we solve the problem that we're working on, the medical problem. So we want them to keep their jobs, stay where you are, and we'll see what happens. Now, if they don't, we have unemployment, we have checks, we have a lot of things happening, a lot of very positive things. Nobody has ever done. Now, this is working with Democrats, this is Republicans and Democrats and myself working together. Nobody's ever done a package like this. It's a great package, but ideally we want them to be able to keep their jobs, keep the pay coming, and I think that's going to happen. Kelly, go ahead.
Mr. President, on your Defense Production Act power, one of the features of that is that the federal government would be able to control the output, whether it's masks or ventilators, get it to the most areas of need, and control the pricing to keep it at a market level so it's not price gouging. One of the things we're hearing from governors, they can't find supplies and prices have gone up. So you've talked about the act, sir, but you have not yet compelled any companies. Why not?
Because we have so many companies making so many products, every product that you mentioned, plus ventilators and everything else. We have car companies without having to use the act. If we don't have to use specifically, we have the act to use in case we need it. But we have so many things being made right now by so many, they've just stepped up. In fact, Mike Pence and I were discussing it before. We've never seen anything like it, where they are volunteering. We want to make masks, like Hanes. I brought that up as an example. General Motors, I bring that up as another.
They go on the
Ford.
open market, sir, right?
They're going to go on the open market. We want them on the open market from the standpoint of pricing, because otherwise it's going to be, we could be very unfairly treated.
Direct them to the places in greatest need.
We are directing states, and sometimes we'll be competing against states, which I don't want, and we'll drop out of the bidding. We want the states to go first. And you know what we're doing is we're helping states. That's what we want to do. Same thing with the testing. We're helping states. We're helping states get to where they want. And we've made tremendous progress in every aspect of it.
This happens for a governor who needs equipment today.
Well, it's happening fast right now, and the governors are out there trying to get, and if they are competing with us, we immediately drop out. Please.
Mr. President, forgive me if I heard you wrong at the beginning, but you said something, we are going to be going over to the Hill. Are you going yourself?
My people are, and I'll be staying here. I'll be in the Oval Office and various other places in the White House.
And on that matter, you're asking Congress to essentially pass a series of legislation that's going to amount to about $2 trillion, 10% of the GDP. What do you say to members in both parties who say this is too expensive, this is just too much to debate and get done in 48 hours or so? And also, have you spoken directly with Speaker Pelosi at all about any of this?
Okay, so I've spoken with, I'm not going to say who I speak with, but I've spoken with directly or indirectly everybody many, many times. We're doing very well. I think the Democrats and the Republicans are going to come up with a package that's going to be really something very special. It's going to help people. This is the first time there's ever been a case where you want people not to work. It's always, you want to create incentive to work. We're creating not an incentive not to work, but the fact is we're asking people not to work because of they have to stay away from each other. If we're going to kill this horrible hidden enemy, we have to stay away. So there's never been a thing like this in the history of the world. And other nations are doing similar things, some effectively, some not effectively. They're doing similar things. We are creating a package that's going to keep companies together, keep workers paid so they can live and sustain. We'll see what the timing is. The biggest thing we can do is get rid of the problem. The problem is exactly what we know, the medical problem. We want to have this whole incredible situation that it can start right away. Not that all these companies break up, all the workers are out of jobs, you can't put them back together, and it would take years to put them back together. Because we had the greatest economy in the history of the world until we got hit by this problem. And we can be back very, very quickly. And it's our intention to be back very, very quickly. So we're doing a package, the likes of which nobody's ever done before. I'm obviously the one that has to approve the different things and the recommendations of the different things. And like buybacks as an example, and stock buybacks, I didn't like it the first time, and this time I'm saying, you're not doing it. I don't want money to be used for that. I want money to be used for workers and for opening businesses, keeping businesses, not buybacks. And well, I am strongly recommending a buyback exclusion. You cannot buy back your stock. You can't take $1 billion of the money and just buy back your stock and increase the value. Please.
On the subject of masks, the Vice President announced HHS was ordering hundreds of millions of them. Was that order just placed today? How is that going to be distributed, and when can doctors and nurses expect to actually receive those masks?
Yeah, HHS is completing a $500 million order of N95 masks, and all of this is being coordinated through FEMA, and we are responding specifically to state requests where the needs arrive. As Dr. Fauci said, we want to make sure the people that are providing healthcare services to people who may have contracted coronavirus have the protection to keep themselves and their families healthy. But I want to emphasize the supply of so-called N95 masks has been vastly increased in the country because the president insisted that we extend liability protection to industrial masks. What all the experts told us early on was that industrial masks that are used on construction sites, the president's very familiar with from his past life, are perfectly appropriate to protect healthcare workers from respiratory illness. But they didn't have the liability protection because they weren't created for hospitals. We worked with leaders in both parties. We added that protection that runs through 2024, that now the industrial N95 masks can be purchased by hospitals, purchased by states, purchased by HHS, and distributed through our system. So we're making those available. The supply has been, as I said, vastly increased, and it was another step forward and a bipartisan accomplishment. And we're continuing to use all the kind of creative means of American industry to make sure that we're leaning into this effort and that we do whatever it takes to make sure that our healthcare providers have the protective equipment.
We are still hearing from doctors and nurses about this shortage. When exactly can they expect to receive these masks, though?
Well, let me let Pete Gaynor speak to that, because FEMA will be, HHS is now fully integrated into FEMA. And so as the requests come in, but obviously, as I'm sure the administrator will say, they're being prioritized to those areas with the highest need.
Yes, sir.
So within the National Coordination Center, we have a supply chain task force. And in basic sense, we're trying to identify the universe of what's out there. So whether we hold it at the federal level, we hold it in the private sector, and then match that up with demand and asking people to be creative. We're asking, again, this is a shared responsibility. We're asking locals and states to try to take a little bit of burden off of us, and then we'll prioritize those scarce resources, because every single governor across the country is looking for the exact same thing. So there's a balance, but we're examining the entire supply chain to make sure that
when will
we make
the masks start coming in?
They're out there now. So again, we want to match. We want to get out of the middle, I think.
I appreciate it. Yeah, that's what I like to know. When will they
suppliers with demand. So that's what we're doing right now. It's happening today.
They can expect them to there. They're matching supply and demand.
There's a range of requests across the country, and we're trying to match those again, supply and demand every day through the task force.
We have a lot that's already come in. A lot have already come in. I have to tell you, the throwing away of the mask, being in private business, the throwing away of the mask right away, they're thrown away. And when you hear 55 million masks were ordered, I'm saying 55 million, how could it possibly be such a number? And they say, oh, that's just a small fraction of what we need. And I said, why aren't we sanitizing masks? You know, you look at the masks, I've looked at all the different masks. Some don't lend themselves to doing that, I think, but many do. And I said, why aren't we have very good liquids for doing this, sanitizing the masks. And that's something they're starting to do more and more. They're sanitizing the masks, and I don't know if anybody would like to speak to that.
We issued guidance.
Yeah, you might want to discuss.
Yeah, there are some CDC guidances about how you can minimize the use of masks by different things that you could do with testing, and when you have masks, how you might reuse them, which ones you can reuse them.
Do you think there's a solution to this other than buying more masks? Do healthcare providers need to change how they're using them?
Yeah, well, there are a couple of things. One, for example, we are moving towards getting testing where you don't have to have PPE. I mean, I'm not going to tell you the day it's going to be there, but it's going to be a swab that you could stick in the nose of the person who is either infected or not, but that person doesn't need PPE, the person who's administering the test. So if you could do a self-administered test, stick it in a vial, hand it over. You don't need a mask, you don't need PPE. That's one of the things we're trying to do.
I would have liked that much better. Personally, yeah, go ahead.
May I? And this is another story about great American industry. I mean, the president and I literally heard directly from Apple that they're donating 2 million industrial masks to this effort around the country, and working with our administration to distribute those. And it might be a good opportunity for us to renew our call as the president and I delivered this message to businesses yesterday, manufacturers and small businesses. It's a great time to go to your storeroom, and if you have N95 masks, if you've got 100 of them, if you've got 10,000 of them, is to load them up, drive them over to your local hospital. That story is literally happening all over the country. And now with more Americans stepping away from elective surgery, including elective dental care, we're urging dentists around America to look at their supplies of N95 masks and make those available to our hospitals. But the great news is, as the president said, the American people are all doing this now. So on behalf of the president, thank you for what you all are doing today, but we want to encourage people in business, encourage people in dentistry in particular. Look at those supplies of N95 masks. Pack up as many as you can spare. Drop them off at your local hospital. It'll be a great service to the country.
Mr. President, I just want to read you some of the doctors on the front lines of this crisis are saying.
You mean the ones that are saying good things or bad things?
These are doctors who are talking about the shortage of medical supplies that they are facing. Dr. Faiza Bucks in Kentucky says there's absolutely no way to protect myself. A surgeon in Fresno, California says we are at war with no ammo. Dr. Mel in Illinois says if this is a wartime situation, then now is the time to act. I know you're talking now about increasing production at so many of these facilities to get the masks out, but given that this is one of the wealthiest, most powerful countries in the world, should this even be happening? Shouldn't this have been resolved weeks ago?
I'll tell you the way I look at it. So many administrations preceded me. For the most part, they did very little. in terms of what you're talking about. This is unprecedented. You could speak to Tony, you could speak to anybody. This is unprecedented or just about unprecedented. As time goes by, we're seeing it's really at a level that nobody would have believed, nobody would have thought possible that this could happen. And we are making much of this stuff now, and much of it's being delivered now. We've also gotten tremendous reviews from a lot of people that can't believe how fast it's coming. When I hear they have an order of 55 million masks, and that's just one order, that's one order out of many, and that there are many millions of masks beyond that, and I keep saying, how is it possible to use so much? But that's the way it is. And part of that is because they'll use a mask for a short period of time and they throw it. The fact is that we are doing a tremendous amount. We started with very few masks. We had some, but nothing for an event like this. And now we're making tens of millions of masks and other things. And I think it's unprecedented what we've done and what we're doing. And many doctors, and I've read many doctors, they can't believe the great job that we've done. Yes,
it has been many,
Kelly, did you have?
It's been nearly 3 months since your administration learned about this virus.
Well, if you remember, I was the one that closed the country down. I was the one that closed the. You don't write that, or you don't say it too much, certainly on CNN. But I just read an article yesterday that by closing the country down so early, very early, we saved tens of thousands and much more than that lives. So, you might want to report that too. Go ahead, Chris.
I'd just like to address that for a moment. Again, I'm an ICU physician, ran health systems, and I first of all want to thank everyone who's on the front line in the emergency room, in the ICUs, in the hospitals. I speak to my colleagues daily. We need to preserve our PPE to the degree that we can. CDC guidelines has had that. The president has talked about it. But I also want to say we are making product, as the president said, but we are also responding through the FEMA system to distribute the strategic national stockpile resources according to requests that come in. Stockpile has been distributed to many states, first orders, second orders, and on a daily basis adjudicating that. If there are shortages in your hospital system, I can't tell you of Dr. X, Y, Z, that needs to be clearly iterated to the local emergency management.
Are you seeing those hospitals talking about the shortages?
We were on the phone 2 nights ago or 3 nights ago with over 2,000 hospitals or hospital systems sharing best practices from Seattle, where they've been very innovative, pioneering some of these areas. When there is a shortage, they need to go through their emergency management. It goes directly up to the FEMA system, which really rocks. It really works very, very well. And then there's the distribution of the stockpile. Now, the stockpile isn't infinite. That's why it's being replaced by all the orders. But mask supplies go out on a daily basis as they are needed and requested through the FEMA system. And I don't know, Administrator Gaynor, whether you want to add to that.
Tony,
just to reiterate what Brett said, we don't take lightly what you just read. I get the calls every night, the way you get emails. It's a serious issue. We don't want that to happen, but it is happening. You're not making things up. I know that because I'm experiencing it myself. But what you just heard about the different avenues, some of which aren't even recognized, about how you can get help through the FEMA process, in addition to the large amounts of additional PPE that's coming into the system. We hope that very, very, very soon, we're not going to get those kinds of real life difficulties.
Matter of weeks? Again, it seems like there's a question about the timeline here, and even FEMA can't quite answer what the timeline is. Days, weeks.
Yeah. Sooner than weeks. It's going to be days. I would hope. We're going to try to make it days to the best possible way we can.
And again, what we're doing is we're trying to help the states get things faster. And that's what we're doing. We're implementing. And the magnitude of this, it's a tragedy. It's an absolute tragedy. But the magnitude is something that no matter who you were, no matter where you come from, nobody ever thought a thing like this could happen. You read about 1917 and you read about certain things, but you think in a modern age, a thing like that could never happen. Well, it comes back. It is genius. It comes back, and it's too bad. But I think the people working on this have been incredible. The job they've done has really been incredible. But there's tremendous amounts of not only masks, of ventilators and respirators and everything you can think of. It's all being, much of it and almost, I could say all of it is being manufactured right now. Steve, please.
Yesterday there were questions about the use of this malaria drug. Have those questions now been resolved?
Well, I don't know that resolved. I could say that it's going to be distributed. I know New York is getting, I think, 10,000 units and numerous other people. It's really, it could be the malaria drug plus the Z-Pak. But, and we're going to find out. We're going to find out. I feel, look, I feel, as the expression goes, what do we have to lose? Because, you know, I feel very good about it. Tony would feel, you know, like he'd like samples done in a certain way, and I understand that too. Many doctors agree with that. We don't have much time. You know, we have a lot of very sick people right now in hospitals all over the place. And speaking with the governor, New York, Cuomo, I said, how's it look? He's got a lot of sick people. So we're going to be delivering a lot of samples to New York and other places, and we're going to find out very shortly whether or not it's going to work. I feel very confident. I mean, I've seen things that surprise me, frankly. There are, as Tony said, there are other things we're looking at too. Vaccine, of course, is incredible, but this is more immediate. Right now, this to me would be the greatest thing that could happen. This would be a gift from heaven. This would be a gift from God if it works. So we're going to pray to God that it does work. It'll be a fantastic thing.
Mr. President.
Yeah, please, Rebecca.
Mr. President, on the economic front, there are reports that the coronavirus is really hurting your businesses, especially your hotels.
My businesses?
Yeah,
Sure.
so is that true, and can you speak
Well,
to
I wouldn't say it's
financials?
thriving when you decide to close down your hotels and your businesses. No, I would say, but you know, I'm very underlevered and everything, so that's good. But is it hurting yeah, it's hurting me, and it's hurting Hilton, and it's hurting all of the great hotel chains all over the world. It's hurting everybody. I mean, there are very few businesses that are doing well. Now, there are some that are, like as an example, the Walmarts of the world, because everybody's lined up to get things and stock up their house and this and that. But sure, it hurts my business. But
And did you or anyone in your administration talk to anyone at the Trump Organization about the potential effects of the coronavirus?
no, I didn't speak to anybody. I speak to my sons, but I talk about the coronavirus, but not as it pertains to my business. They basically follow the rules. When they say close them down in New York, we close them down, or wherever they may be. I actually have them all over the world.
Will you no longer
And
go
when they
to
say close them down, we close them down. What, Kelly?
Will you no longer go to Mar-a-Lago or Bend?
Well, I have nothing planned at Mar-a-Lago, but right now I think Mar-a-Lago, I guess, I haven't even asked, but I imagine that's closed down just like a lot of other businesses in Florida, right? Go ahead.
Do you expect your family company to seek government assistance if it's eligible?
I don't know. I mean, I just don't know what the government assistance would be for what I have. I have hotels. Everybody knew I had hotels when I got elected. They knew I was a successful person when I got elected. So it's one of those things. I guess I get paid $450,000 a year. I give it up. I put it back into the nation. I have to, by the way, you have to designate where you want it. So I oftentimes give it to opioid, research and things.
Specifically, not you.
But as far as the hotels and everything, I mean, I have to do what everyone else is doing. I would probably decide to close things up. I think it's a good thing. You don't want people getting together. And hotels and clubs and everything, you get together. We want to beat this deal. So I have many of them, hotels, clubs, things like that, where people get together. I would think it would be a good practice to close them up. Yeah, go ahead, please.
Mr. President, as you know, we've been talking a lot about masks. We've also talked about how not everyone needs to take a test. What about a temperature test? As we know, we all came into this room and got tested before we entered.
Well, I do it. I have temperature tests, and I didn't ask everybody here, but I wouldn't be surprised if they had temperature tests.
Should those thermometers
Otherwise, I'm going to run off the stage.
be distributed? Should they be on a mass distribution basis too?
Oh, I think they are pretty much. The easiest thing is the temperature. I think they are. I don't know. Are you learning a lot from the temperature test, Tony? Could you maybe discuss that for a second?
Yeah, I mean, they have a place. They're not infallible. I mean, there's so many ways to get around that. I mean, right now, every time, certainly here, we get every time I go into a different room, I get my temperature taken. But we see that on the outside that some people are doing that.
I took his temperature twice, actually.
It was very low. There is a role for it under certain circumstances. A massive distribution of thermometers that are going to actually have a major impact on what I showed, what we need to do.
And I say, I've seen things when Tony mentions thermometers. They aim something at your forehead, they stay this far away, boom, and they tell you what your temperature is. I said, I've never seen that before. I've learned a lot. It's incredible.
The Washington Post ran a story suggesting that you delayed taking action on the virus in January and February. Dr. Fauci has indicated that your action in the Chinese travel ban helped America immensely. What do you say to the Washington Post?
Well, I love whoever you're with. That's because I think that's such a nice question. No, I think the Washington Post covers us very inaccurately, covers me very inaccurately. I saw the story. I think it's a disgrace. But it's the Washington Post, and I guess we have to live with it. It's a very inaccurate, quiet. It's a very inaccurate story. From many people, I get a lot of credit for having closed our country very early to a very heavily infected country. China, unfortunately, China. I wish China would have told us more about what was going on in China long prior to us reading about it, even though the news isn't exactly disseminated. As you know, China kicked the Washington Post out of China, and they kicked the New York Times out of China, and I guess the Wall Street Journal. That's okay. I mean, that's what they do, and I think it's a terrible thing they did. But I also think it's terrible when people write inaccurately about you, and they write inaccurately about me every single day, every single hour. And by the way, your group really, I really think, and I just say fair, not good or bad. I think you write very fairly and do very fair reports about the great job that all of us are doing, that this group behind me is doing. It's so insulting when they write phony stories that they know are fake news, because they're not insulting me, they're insulting everybody, these incredible people that have worked so hard, so long, that are thinking about nothing other than this invisible enemy. They have done such an incredible job, and they will continue, and we're going to win, and there'll be a lot of celebration when we win. And we're going to win with as few lives lost as possible. That's the game. Win with as few lives lost as possible. It's a tough enemy. It's a tough killer. Far bigger, far more vicious than ever before. But I appreciate you saying it, because the fact that we closed so early to China, and most people, hey, look, I was called xenophobic by Sleepy Joe Biden. I was called a racist by Democrats, a racist. I was a racist because I decided that I didn't want to have people that could hurt our country come in. And I was pretty much in a very small group of people, I will tell you. It was a tiny little group. Most people, even that worked in the White House, disagreed with me very strongly. Saving of those many weeks was a tremendous thing. And when they keep talking about acting early, that was the ultimate act. That was the biggest act, because we didn't. And then I also closed Europe early, very early. And I took a lot of heat for that too, but that was a good thing. Now they're doing similar things that we're doing. So I didn't act late. I acted early. I acted far before anybody thought I should be. I took tremendous criticism from the various papers, from many of the papers. So I very much appreciate the question. It might have been more of a statement than a question, but whatever it may have been, I appreciate it very much.
Mr. President, about this, so a number of the states have kind of done these different measures. We've seen California order one thing, New York, just be similar. Do you want all of the states to do one uniform?
No, they can do what they want to do. If California can get a mask sooner than we can get it for them, through all of the things we're able to do, I mean, we're going to end up with a big oversupply at some point. At some point, this is going away, and we're going to end up with a big oversupply. And you know what? In this case, that's going to be okay. But if Gavin can go out and order gowns faster, or masks, good masks faster, or other things faster, that's good. We do have a lot of, the coordination with the ships that we're sending in, as you know, the medical ships that we're sending in, and even cruise liners. We're going to be sending in probably cruise liners into some areas, in particular California and in particular New York. But if somebody can do something faster, if they can order that mask faster than us, I want them to be able to do
Sorry
it.
about the rules, sir. So people can't leave their homes. That certain businesses. That are
We
exempt.
coordinate very much with them, yes.
You don't want all of those to be the same.
Well, it doesn't
nationwide.
have to be at this moment because we have places in the country where, states where they have 2 people or 3 people, and those people are in quarantine. And you can't put on them what you're putting in New York, where you do have a tremendous problem. I mean, we have large portions of the country, Middle America, where, they have a few people. So it may be a time, I hope that never happens, where we need to take very drastic action. But right now, that's not in the same ballpark. Yeah, go ahead, please.
We're day 6 into your 15 days of recommendations.
Yes.
A lot of people are following them. Some people are not.
Yeah.
Do you think the American people are doing enough right now to slow the
I
spread
think
of this
they
virus?
are, and some people are not, but I think they are. I think it's going to have a very profound effect. I mean, we'll know a little bit more on day 14 and 15, and we'll
What's the
see.
plan once we get to
Well,
the
we're
end?
going to see. We have to see what the result is. We want to flatten that out, and we're going to see what the result is. And I just want to say, I'm going to negotiate a very large transaction, and I've been negotiating it for 2 days. So I'm going to take 1 or 2 more questions, and then I'm going to leave it to Vice President Pence on the Hill, with the Hill, the various elements of the package. Steve, go ahead.
There's a number of groups are calling for the postponement or cancellation of the Olympics. Have you given him third?
No, I haven't. Look, we understand the difficulty of that, and he's a very good friend of mine. You take a look at Shinzo Abe. He's a great gentleman. He loves his country. We have an incredible relation. We just finished a trade deal with them, $40 billion trade deal with Japan. And Prime Minister Abe has a big decision to make. They have built one of the most beautiful venues I've ever seen. They're all ready to go. It's not late. It's not over budget. It was just done flawlessly, and it's beautiful. And they're sitting back and saying, I told him, I said, that's your decision, and it is his decision. And I know he's going to make it soon. I don't know what it's going to be, and I didn't think I should be influencing it at all. I mean, the job that Japan has done on that venue is incredible. So, I mean, there are options, obviously, including delay and maybe delay for next year, but that's totally up to them. We'll see what they do.
Since this story keeps popping up, when did you first learn that this was going to be a problem?
Well, when I learned, I started doing the closing. So, probably around that time. We didn't learn much. I think you're going to ask a little bit about China responsibility. I do think that, again, I have great China are incredible. I have a tremendous relationship with. Wish they could have told us earlier about what was going on inside. We didn't know about it until it started coming out publicly. But I wish they could have told us earlier because we could have come up with a solution. Tony Fauci and all of the people, the talent that we have, would have loved to have had 3 or 4 months of additional time if you knew that this was going to be happening. They didn't have that time. They read about it in newspapers like everybody else. China was very secretive, okay? Very, very secretive. And that's unfortunate. With that, I have great respect for that country. I have great respect for the leader of that country and like him. He's a friend of mine. But I wish they were able to, I wish they would have told us earlier, Steve, that they were having a problem, because they were having a big problem and they knew it. And I wish they could have given us an advance warning, because we could have had a lot of things. As an example, some of the things that we're talking about where we order them as quickly as we can. If we had a 2 or 3 month difference in time, it would have been much better. Yeah, please.
Can I follow up on that? Because as you were saying, China was extremely secretive about this. Several of your advisors have been warning, have been critical of China. Secretary Pompeo was talking about it yesterday, and he had been saying so for quite some time. So why then, on January 24th, did you tweet that China has been working very hard to contain the coronavirus, that the United States greatly appreciates their efforts and transparency?
Because
it will
it's
all
true.
work out well.
Because
Why were
it's
you
true.
saying that?
China has worked very hard. China has lost thousands and thousands of people.
Right?
No, they weren't transparent. They were transparent at that time. But when we saw what happened, they could have been transparent much earlier than they were.
A month after China
But
discovered
China,
the
just so
virus.
you understand, China is not a beneficiary here. China has lost thousands and thousands of people. China has gone through hell over this. They've gone through hell, and I've had conversations with President Xi. I just wish they could have told us earlier. They knew they had a problem earlier. I wish they could have said that.
Are you able to share, thank you you for the numbers on the testing, by the way. Are you
Thank
able to
you.
share any other hard numbers on number of available tests, on number of ventilators in the federal stockpile?
Well, I'm going to leave that up to Dr. Fauci and everybody else. And I think the answer is we want to share them. I would imagine we want to share the numbers as, Admiral, do you want to discuss that?
500 billion masks that you cited, they're due for delivery in 18
Not
months.
billion, no, not billion.
500 million masks, excuse me, thank you.
I said, wait a minute.
The half a billion masks, they're due for delivery according to HHS within 18 months. The last number on ventilators we had was 12 to 13,000. Can you give us an updated number?
Well, there's
on that?
never been numbers like this. You know, a ventilator is a machine. It's a very complex machine. And to think that we have to order hundreds of thousands, nobody's ever heard of a thing like this. You know, when we had in the stockpile, we had thousands in a stockpile, thousands ready to go. That's a lot. All of a sudden, you need hundreds of thousands. And you're not talking about, you know, the mask is whether it's plastic or whether it's material. That's one thing. But you're talking about a very sophisticated, heavily computerized machine and delicate. And you need hundreds of thousands of them. Nobody's ever heard of a thing like that. With that being said, General Motors, Ford, so many companies, I had 3 calls yesterday directly. Without having to institute like you will do this, these companies are making them right now. But to think of these numbers, it's pretty mind-boggling.
Do you have numbers to share though right now? Do you have numbers to share with us right now?
Well, Mike, go ahead, please.
Yeah, you bet. Well, we've spoken a lot about masks this morning, but the president's also given the task force a priority of assessing the availability and expanding the availability of ventilators. And on Monday, we will detail some very encouraging news for Americans. You speak about the number of 13,000. It is a little more than that we have in the national stockpile. But it's important to remember that that doesn't include the more than 100,000 ventilators that are in healthcare facilities and hospitals around America today. It doesn't include what will be these manufacturers tell us produced, as the president said. We're seeing many of them are literally surging forward to create more ventilators. But one of the more exciting developments in the last week, which we'll detail more on Monday, is that in the president's engagement with our healthcare community, we learned that ventilators that are currently used by anesthesiologists, that are used in outpatient clinics and in other procedures, can be converted to be used as ventilators for people struggling with the effects of the coronavirus. We've confirmed that a particular screen in that device can be changed readily. We're working with the FDA to approve that. But again, it's a great testament of the American people and our healthcare professionals that are stepping forward and bringing ideas forward that literally, as we'll document Monday, will increase the supply of ventilators by tens of thousands. But look, the president's made it clear. We want to make sure that all the incredible, courageous men and women who are serving in healthcare around America have the support they need, that our patients that are struggling with recovering from coronavirus have the equipment they need. And we'll have a lot of detail on Monday as we continue to assess.
8 days ago that we
what's
would
available.
have 1.4 million tests on board by the end of this week, by today. Do we have that? Can you give us the number that we have?
Let me let Admiral Goff speak to that.
Thank you.
So I'm going to answer your question and then try to persuade you to stop asking about a specific number, okay? So from March 2nd to March 14th, we have put over 10 million laboratory tests into the U.S. commercial market, and we expect that by March 28th to be well over 27 million into the market. So that answers your question, and let me tell you why it's not the right question. Not every lab can run every test. Not every test is clean. So the more important question is not how many tests are in the market. We got them in the market, but it's as the kind of test that they can use.
Yeah, no, we're using your numbers, trying to find out for the public if the things you've promised are happening.
Yes, they are happening. They are. We promised 1 or 4 million. There's 10 million tests in the market now.
Are the masks that are in the strategic reserve being deployed, Mr. Vice President?
Yes, the masks in the strategic national
So
stockpile.
it's not 13,000 anymore. It would be a lower number. Would that be fair to say?
Masks are
No, the ventilators. I'm sorry, the respirators. Thank you. we're trying to understand if the things we have been told sitting through these briefings for many days are happening and getting into the hands of the healthcare providers.
You understand it. You understand it. You're an
understand
intelligent woman, Kelly. You understand exactly what he's saying. And what he's saying is rather incredible because we inherited an obsolete, broken system. And when you hear the number of tests that we'll be providing and are now, it's incredible. And I've heard a lot of governors say the same. An obsolete, broken testing system that wouldn't have worked for even a small problem, let alone one of the biggest pandemics in history. And what these gentlemen have done is incredible. I am going now to negotiate a great deal for our workers and our citizens. I'll be back tomorrow. We're probably doing this tomorrow. And if I might, I'd like to ask Vice President Pence to take over. And thank you all very much. Thank you.
Thank you, Mr. President.
Mr. Vice President.
Thank you all.
Sorry, Mr. Vice President.
How about back here?
Mr. Vice President, the military has sent planes to Honduras, Morocco, and Peru to pick up Americans and bring them home who have been stranded there. But there's still a lot of other Americans who are stranded and can't get home. So does the military plan to send planes to pick those folks up? Where will those planes be going? When will they be going? And can you assure Americans that who are stranded in foreign countries that they will be able to get home?
Well, we received a briefing this morning from the State Department about their efforts. And we want to be very clear. While the President has suspended all travel from Europe, including the UK and Ireland, suspended all travel, of course, from China since January, that any American who can get home can come home. They'll go through additional screening that's all been implemented and is working in an orderly way at a number of airports around the country. But there are instances, Morocco being among them, where there simply are not flights to get home. Our State Department has been working very closely with our embassies in those relevant countries. I was told this morning that all the way going back to bringing Americans back from China, that we have made individual efforts to bring home about 3,000 Americans. I think there is an ongoing effort to address that with chartered commercial flights that the government is providing. Obviously, also military transport is available, but our task force received a briefing this morning, and we would just encourage any American that's looking on from overseas, contact the local U.S. Embassy, let them know about your circumstances, and know that we're going to continue to work very diligently to get our Americans home.
All right, guys, last question.
Two quick ones, education and a medication one. You guys have announced that standardized testing is essentially canceled in this country. To the tens of millions of students out there, their teachers and their parents who are sort of scratching their head wondering, well, what does that mean? Obviously, a lot of this is driven by local school districts, by the state. Is there any federal guidance on this? And if not today, could you have Secretary DeVos or somebody come and explain that to the millions who are literally sitting at home, trying to figure out what exactly that means?
Well, I think it's a terrific question. And we will bring Secretary Betsy DeVos here tomorrow or on Monday to address our efforts. The objective here was as people are embracing the President's 15 days to slow the spread, we have decisions by local school boards and local and state officials that have canceled school or suspended school for a time. And we wanted the Federal Department of Education to make it clear that the burden of standardizing testing, which back in my days as governor, I remember takes a number of days and sometimes up to a week to administer, is not going to be placed on schools. But we'll have the Secretary here to address that very specifically, and it's a very good point on your part.
I mentioned I had a medication question, and I wanted to ask it while the President was here, because earlier he tweeted that there were two certain medications that when taken together, quote, have a real chance to be one of the biggest game changers in the history of medicine, and that they should be, quote, put in use immediately. Since he's not here, I can't ask him what he meant, but I'm wondering if Dr. Fauci or the Admiral could clarify if you have any sense of what he was talking about, and whether his 74.5 million Twitter followers should be taking medical advice from him or from someone else.
The President brought together the top pharmaceutical companies in America and in the world a number of weeks ago. And they formed a consortium to work on a range of responses, beginning with therapeutics, which for a layman like me, that just means medicine to make you feel better. They're already going to work on that. We actually think, Dr. Fauci, I think there's some sense that that our great pharmaceutical companies may actually be producing therapeutics that'll give relief to Americans struggling with coronavirus as soon as this spring. We also challenge them to work together as rapidly as possible to develop a vaccine going forward. And as Dr. Fauci has indicated, we brought a vaccine to clinical trials now the better part of a week ago, the fastest time in history. Now, it's the first phase of the trials, and people should understand, experts have described, that there'll be a period of, as a year and a half before we can make those vaccines available. But as the president said at this podium, there is some anecdotal evidence that several existing medicines may have brought relief to patients struggling in China and in Europe. And the president has tasked the FDA to work very rapidly to allow what's called off-label use for those. One is a malaria medicine. But this morning, I think the president reiterated the hopefulness that he feels about this, that because these are medications that are time-honored and tested, they've been taken for many, many years, that we want to pursue, number one, making those available if someone's doctor believes that it's appropriate. The doctor would be able to prescribe that medicine even though that's not indicated. That's called an off-label use. But the other piece is, as Dr. Fauci said, and I'll yield to him, those medicines, we're working specifically with one state, so in a way that represents a clinical trial. So it would not just be compassionate use, which the medicines are already being used for in some jurisdictions today, but also we could study it and determine the viability of it. And in fact, we're working diligently right now with that supply chain to make sure that those medicines are available. Dr. Fauci, did you want to speak to that?
Sure. You know, it's essentially what I said multiple times from this podium, is that when you have, first of all, we're trying to develop de novo drugs that are not yet out there, not approved, that ultimately would be effective. And the way you prove that is to do a randomized controlled trial to prove safety and efficacy. I'm not totally sure what the president was referring to, but I believe he's referring to a report that used both hydroxychloroquine and azithromycin together to have some possibility of being an effect. Many of the things that you hear out there are what I had called anecdotal reports. They may be true, but they're anecdotal. So the only thing that I was saying is that if you really want to definitively know if something works, that you've got to do the kind of trial that you get the good information. The president is talking about hope for people, and it's not an unreasonable thing to hope for people. So when you have approved drugs that physicians have the option in a decision between the physician and the patient, are you going to use a drug that someone says from an anecdotal standpoint, not completely proven, but might have some effect? There are those who lean to the point of giving hope and saying, give that person the option of having access to that drug. And then you have the other group, which is my job as a scientist, to say my job is to ultimately prove, without a doubt, that a drug is not only safe, but that it actually works. Those two things are really not incompatible when you think about that, particularly when you're in an arena where you don't have anything that's proven. We went through the same sort of thing with a little bit of a different twist during the HIV/AIDS epidemic until we finally developed drugs that were absolutely knockout drugs that were safe and that were effective. But in the beginning, there was that tension about that. So you really got to have a balance. I've got to do my job as a scientist, and others have other things to do.
Great.
Mr. Vice President, question for Dr. Carson? Yeah, question for
Let me just, if I may, let me just say, I hope this morning has been informative. We will be back again tomorrow. And I hope the American people are encouraged because of the incredible whole of government approach, because of our collaboration with states. You're seeing testing expanded all across the country. That incredible public-private partnership with commercial labs is now making testing available by the tens of thousands. We're working very diligently with an incredible response from American industry to make sure that personal protective equipment, and ventilators, and all the things that our healthcare providers need to meet this moment is there. But let me just say again what every American can do today. And that is, first and foremost, heed your state and local authorities. There are individual states, California, Washington State, and at this moment, especially New York, that have issued guidance to their citizens. And as the President said, we wholly support the leadership that those governors are providing in their states. But secondly, every single American can put into practice the principles of our 15 days to slow the spread. The President's coronavirus guidelines, as I said, we're 6 days in, and the purpose of these is not because every American is at risk of serious illness. As we said before, all our experts tell us, all the data shows, that the risk of serious illness to the average American remains low. But because the coronavirus is, we think, 3 times more contagious than the flu, to slow the spread, to literally lower that curve and spare Americans around our country with being exposed to or contracting the coronavirus, or worse, every single one of us can put these principles into practice. I recommend that you go to coronavirus.gov, sit your family down, call a neighbor and a friend, support efforts in your local community to put these principles into practice. And as people all across this country continue to do just that, I just know we'll get through this, and we'll get through this together. Thank you all.
Will there be a briefing of our sir?
We'll be back. Thank you, Mr. President.
Thank you, sir. Thank you, sir. Thank you.